We're very excited to have you here tonight for our April Lymphedema night, where we will be welcoming Kati Mackenzie, who is a certified lymphedema therapist, a reflexologist, and a teacher by trade. She became interested in reflexology through her own health journey and received certification as a Dien Chan zone operator from the Italian AIRFI Academy. In Canada as well, she trained with the Dien Chan multi-reflexology and Chan Butte reflex therapy, and then became a registered Canadian reflexology therapist with the Reflexology Association of Canada. So she started using RLD, or reflexology lymphatic drainage, to help care for a family member with lymphedema. And last year, that inspired her to become a certified lymphedema therapist. And she is actually one of the Alberta Lymphedema Association's therapist scholarship recipients. So she did that training last year. Hopefully, Kati, you'll share a bit more about your story in your presentation, but if I said anything incorrect, feel free to correct me. Otherwise, I will pass it over to you.
Thank you very much. Welcome. My name is Kati Mackenzie, and I live in Canmore, Alberta, and I work as a reflexology therapist and a lymphedema therapist here at Etana Wellness. Now, as you said, my mom unfortunately has lymphedema in both knees and legs, and of course, I was trying to find anything and everything how I can help her. So that was my motivation to find reflexology first and then go further and learn more about lymphedema and lymphedema care. So today what I would like to share with you is that how I connected reflexology and lymphatic drainage and took the course Reflexology Lymphatic Drainage, which is specializing in a form of reflexology where we can help clients, we can help people with lymphatic issues. And this course, what I took was in 2021. And I saw myself the results of this special method. So I thought that as we go to different therapists, we have our 30, 60-minute time, and then we go home, and then we are not really sure how we can help ourselves or how we can help others in between treatments. And also, just as we know, lymphedema is not going to go away. It's not going to wait for 2 weeks for the next meeting. And we are able to do things to ourselves or for our loved ones. So today I would like to share what reflexology is. I would like to share what reflexology lymphatic drainage is as a treatment if you go to see somebody who is trained in that. Or actually, reflexology therapists are trained to work with the lymphatic system, but it is a little bit added to this treatment. And then at the end of the presentation, I would like to show you how you can do this treatment or similar in between treatments every day for yourself or someone you are caring for. So first of all, I'm just going to see if I can go to the next slide. So I'm not sure if you know much about reflexology. Reflexology actually gained kind of a larger scope lately because people are looking for something which is more hands-on, more natural, more complementary, and of course non-invasive. And this is what reflexology is. Reflexology is a way of touching the feet, touching the hands, ears, and even the face to apply gentle pressure to reflex points and cause an effect in the body. most people would know that reflexology is extremely relaxing. When someone comes to my treatment, I would say the first thing is, oh, I could never sleep. I will never relax. And then give them about 10, 15 minutes, and then they are out dreamland. So even you don't necessarily want to relax, but because I am cause and effect by um, pressing on certain nerve endings, I am able to put the body into a nervous system, a relaxed state where the body will have the opportunity to balance itself. So I am not, let's say, we have a client who comes in with a certain issue, and what I'm creating, I'm not diagnosing, I'm not treating the certain illness, let's say, but what I'm doing is I'm helping the body to find ways how it can balance itself. So when the let's say I'm doing a foot treatment, when I'm pressing into certain reflex points, I am creating a pressure on that nerve ending, which will actually have a reaction in the body or body system, which that area is, the reflex point is. So reflexology it's not new. We have had it many thousands of years ago already in China, where we work with the qi to balance the energies. In Egypt, already 2,000 to 3,000 years ago, we have found paintings where they are showing reflex or hand and foot treatments. And even in the Indian system, they have certain pressure point treatment therapies. In the Western side, we have Dr. William Fitzgerald, who was a medical doctor, and he introduced the zone therapy. And I will explain that a little bit. And then Eunice Ingham, who was a physiotherapist and who mapped the reflexes. You can see her portrait right here. So the zone therapy, what you see here means that the body is divided into 10 sections and vertical and horizontal way. When the therapist is pressing into a reflex point, that is going to take an effect to all the system which are in the same zone. Therefore, there is an opportunity for the treatment to be very beneficial, where I can connect certain sides, certain parts of the body. When we are looking at the horizontal lines of the foot on this image, you can see that the head is corresponding to the top of the foot. The chest area of the body corresponds to the ball of the foot. The abdominal organs are at the arch, and the pelvic or hip area is down in the bottom part of the foot. When we are looking at the reflexology maps, we have very different ones. This is just one of them. But what the foot reflexology map is showing the different organs reflected on the foot. Now, we can also work on the hands or the face, and I'm going to show at the end how we do that. But if you look at this image of the foot reflex map, you can figure out that basically the toes are the head. You can see the different glands, the brain, the sinus, reflex points, the neck, and so on, where we are able to very specifically look at different systems where they need balancing. Also, the right and left side of the body corresponds to the right or left foot, hand, or the side of the face. So, for example, if someone has an issue, I can palpate on the body where there might be a change in texture, temperature, or even when we are examining the foot, the areas of calluses or folds on the foot would tell us if there is stress on the body. So when we are connecting these reflex points, we are working with systems. So I'm not only just working, let's say, digestive system, the stomach and the intestine, but what I'm trying to do is, for example, when I'm working on the digestive reflexes, I might be able to influence and relieve some bloating or adrenal reflex, which would support the stress or against the stress response. When you are studying reflexology, there are different schools, different ideas, and there is also where we can work energetically on the body, not only physically. So, for example, I can raise the energy, I can calm the energy, depending how I am, which direction I am using the movements. Now, when I'm looking at the hand reflexology image or chart, that's the same idea that the whole body is reflected on the hands. The other area we would like to connect to reflexology is the lymphatic system. And fortunately, we are really lucky that the Lymphedema Association is hosting a lot of talks. And if you're interested in a detailed explanation of the lymphatic system, you can find information, of course. So just how this connects is that we are talking again about a system, the lymphatic system, which is connected to the immune system and the circulatory system. So when I'm working on the lymphatic system reflex points, I am also affecting the immune system and the circulatory system. For example, the lymphatic system is very crucial in our health and immune system. And actually, without it, we couldn't be functioning as a human being. The lymphatic system is also producing or moving lymph fluid, and how the lymph system is made up with lymphatic vessels, lymphatic nodes, vital organs, including the spleen, thymus, and tonsils, then they are all working together, filtering waste, trapping pathogens, producing immune cells, and also in the digestive system, we are also working with moving fat or lipids. Now, if you look at the key functions, it's very important. So how can we support that in everyday life? You see the lymph nodes there throughout the body. And if you noticing it, that we have certain areas where we have a grouping of lymph nodes, and those are very important because those lymph nodes are cleansing the lymph fluid and pumping the lymph fluid up towards the heart. Now, the lymph nodes are, as you see, the armpits, the neck, the groin, and abdomen area. The placement of them is to monitor regions and areas where it would be more vulnerable to infection as well. Now, the components have specialized jobs and they work together to defend and cleanse the system. The interesting part is that how the lymph fluid is actually draining back into the circulatory system. And on the right-hand side of the body, you can see that 1/4 of the body drains into the right subclavian vein, and the rest of the body drains into the left subclavian vein, which is going to bring the fluid back into the circular system and also maintains the fluid balance in the body. Now, this picture already is important for our reflexology because let's say someone has more fluid in one side of the body than the other, then I would work on that side of the foot, for example, a little bit more to activate those lymphatic reflexes to help the flow of the lymph. And since you know the lymph will help the flow, help us move those certain particles in the lymph fluid, but what can we do to help our lymph flow? Movement, deep breathing. I put here gravity posture as you sit, as you work. External stimulation like manual lymphatic drainage or reflexology, because it's all enhancing the circulation of the blood and the circulation of the lymph. Drinking lots of water, and I personally love the vibration plates and the rebonding. What I use myself, it just helps to get the whole body working. Now, the reflexology contraindications are actually really similar or almost the same as the manual lymphatic drainage would be, in a way that we have to take a detailed health record before we see clients for reflexology, just to make sure that we are not causing any harm by, let's say, moving debris or moving a blood clot or anything where we don't know what the cause would be. At this point, we are going to work with the idea of reflexology lymphatic drainage. Why is it different than the regular reflexology treatment? So the reflexology lymphatic drainage, or we call it RLD, was actually developed by Sally Kay, and in the slide here you see her book. It's available on Amazon, and it's a very beautiful book where we go through the different steps of the RLD. And the reason I am really drawn to this method, because it is well researched. It is tried out in many different settings in the UK, and also it's supported by thousands of reports and case studies by specialists and reflexology therapists, where we can actually see the results. Now, this technique is designed to support the healthy flow of the lymph fluid through the body. And while traditionally reflexology focuses the balancing of the whole body, RLD owns in on reflex points linked to the lymphatic system, primarily located on the feet, occasionally on the hands and the feet and the face. By stimulating these reflexes, the aim is to assist the lymphatic system in performing in its essential functions, providing detoxification, reducing fluid buildup, and supporting the immune health. As this RLD was developed, actually it was developed during Sally's work with breast cancer patients who were suffering from lymphedema. Lymphedema is swelling caused by buildup lymph fluid, and Often it occurs after lymph node removal or damage during cancer treatment. So her first research started with the cancer clinic. Through clinical trials and studies, Sally discovered that stimulating the certain lymphatic reflexes could reduce swelling and ease discomfort. And her approach became known as RLD and is used in actually many hospitals and hospices in the UK. It is a very gentle, very specific protocol. And reflexology itself is also very gentle. It's not about doing a massage where I'm wanting to reach the muscle level. It's about talking to the reflex points. Now, when I am following the steps of RLD, I am mimicking the same way as we would do manual lymphatic drainage on the body without touching the areas which might be uncomfortable. It is sore, or some people have mobility issues. So I don't have to go there. I am touching the feet. The RLD sequence can be used for primary or and secondary lymphedema, and its effect also helps with fatigue, inflammation, fluid retention, and just feeling better, reducing the inflammation in the body. The one of the reasons why RLD is so important, in my opinion, because it's so gentle and it also supporting clients who, let's say, going through or went through cancer treatment, and I I could just imagine how stressful that whole treatment plan could be. So therefore, it is very beneficial for people who go through or went through the cancer treatment. Will reduce the stress, reduce the cortisol, and they are going to benefit from the relaxing part of the reflexology treatment. This image here is her website, and I would encourage everybody, if you're interested, to look at her website. She is explaining her methods. She has all the research and publications on her website. So if you're a person who enjoys research, that's a very good way of learning more about RLD. Now, in this one is just one research article in 2020 where they were doing a study on breast cancer related lymphedema. Also, I have to explain that when we have RLD, or we are working with the client and using RLD, we always do a pre and post measuring sequence. So, for example, if I'm working on a leg or lower limb, we are measuring the leg every 4 centimeters before and after treatment. And we have a formula where we put in the centimeter amounts, and it will tell us how much fluid was taken up by the body from that limb. It is sometimes very small amount. A person would just report that, well, my rings are a little bit looser, or look at, I can put my foot into the sandal. Some cases there could be also that a larger amount, although there's always a maximum amount what the body can take at one time. I myself also did the case studies, and I was very surprised how RLD, actually, my measurements were very similar to other therapists' measurements, which means that they spike at the beginning and then they taper on a little bit, but they hold longer as you continue the treatments. So, for example, instead of going, treatment, fill up the lymph, treatment, goes down, goes up again, it has a little bit of an ease to it. And it's very beneficial for people, especially who are the mobility is very much influenced by that. So these are a couple of the benefits of the reflexology lymphatic drainage, and I would say that the RLD is going to help everybody, not only clients who are suffering from lymphedema, but also everybody who will benefit from the circulation taking up more the lymph fluid, or immune system will improve. The reflex points for the lymph drainage is, as you see, very similar than the points what we use when we are doing manual lymphatic drainage. So what I'm going to do is I am going to show you, I'm going to stop sharing the screen, and I'm going to show you the actually first I'm going to show this one, but I'm going to show the same on a foot model, and if you are interested, you can have your own foot and find those points where we can press into. I will show you how to do that. So on the plantar side, which is the bottom of your foot, you can see that we have the red line with a diaphragm. Obviously, when we are breathing in and out deeply, the diaphragm is going to move the lymph. And when I am touching that line on the foot, which is right underneath the ball of the foot, I'm stimulating the diaphragm. The cervical lymph nodes are right by the base of the big toe, and the cervical lymph nodes are responsible for draining the head, the neck, the throat, the upper respiratory tract. And when I'm pressing into that, it is going to cause an effect of draining everything down into the terminus. Now, also helps with sinus congestion, sore throat, or swollen glands. But the lymphatic drainage also encourages the fluid to drain from the face. So it helps it relieving puffiness and release inflammation in the upper body. The neck area is also opening up the whole drain system. So we usually start at that area. Now, the little brown shape there, what you see, that's the spleen. It's only on the left-hand side, left foot, and it is responsible as an essential organ for filtering the lymph and producing immune cells. With stimulating this point, we boost immune function and support the removal of the waste and the damaged cells. The whole abdominal area is important. That's the middle of the foot, is also because it serves the digestive system and the central organs. And for example, when I'm working on the stomach and intestine area, which is that middle part, I'm stimulating the lymphatic movement through the abdomen, help relieve bloating, enhances digestion, and contributes to detoxification. The orange line, or the top of the orange line, is the kidney, and the line going down into the bladder area. So we flush the fluid out. The dorsal side of the foot looks like this. The green little dots between the toes are the lymphatic reflex points of the lymphatic nodes, and the thoracic duct is between the first and second toe, like big toe and the second toe, in a dark green dot. I'm not sure if my pointer can see that. So again, this stimulating the systemic lymph flow and supports detoxification. It is especially good and important for full body fluid balance and immune function. I am going to show you how to activate that little part. Now, if you go to the right medial foot image there's a green circle, and that would be the cisternochyli reflex points. So this cisternochyli acts as a lymph reservoir, collecting fluid from the abdomen, the pelvis, the lower limbs. So when we are pressing into that, we are targeting areas where the lymph is flowing upwards and towards the thoracic duct. The blue line on the right medial image is the spine, so it's around the lumbar spine area. The lines on the right lateral foot image, or actually dots, sorry, bright green dots, are the upper body lymphatic node reflections. And the very side one is the right by the pinky toe is the axillary node reflex. So the axillary lymph nodes manage the lymph from the chest, upper back, and arms. And this reflex point is very important for people who have issues with swelling after mastectomy or breast surgery, and that stimulates that axillary node area. The pinkish circle on top of the foot is the breast chest area. Again, stimulating that will help with the clearing of fluid from the upper section. Now, when we go down to the right dorsal image here, you see a line across the top of the foot, and that would be the lower lymph groin area. If we want to stimulate the lower inguinal node areas, that would be, and I will show you on the foot model how to do that. The same goes for the hands reflect points. So if you see the red line there is the diaphragm, the blue is the spine. You see on the left hand the spleen and the kidney and the bladder. So it has the same idea, is just a different setup on the hand. The dorsal side, which is top of the hand, has the same idea in between the fingers. The webbing of the finger would reflect the upper lymphatic nodes, and the dark green line between the thumb and the pointer finger, index finger, a little bit lower down towards the center. That would be the thoracic duct. The cisternochyli just at the edge of the thumb, and on the top part at the wrist crease would be the lower lymph reflex points. Now, the how do we do this? So I'm going to stop sharing this one. And I'm going to get my models. So if you want to look at how I would do it on my own foot, and if you want to practice with me, that would be welcome. But I'm just going to give you a couple of tips and ideas what I would give to my clients after an RLD treatment. So as I said, we work on the foot, on the hand, and also we can work on the face. So I'm just going to show you one little image here. That's the reflex points or reflections of the body on the face. So if you notice it, when I am looking at the neck, the axillary, the armpit, the hip area, or even on the knee. So I would take a little, something with a very smooth end, and I can gently stimulate the shoulder area on both sides, the neck. This would be the hip on both sides. So stimulating those lymph reflexes. Then around the mouth would be the knee, and bring it down here. That would be the foot. Or the same with the hands. So that would be here by the edge of the eyebrow, the wrist, and then I would bring it in to the axillary area. So we can do the same in our face. Now, when we are looking at the foot, I have my little handy feet. So this is the right and this is the left. I'm not sure how that kind of relates in the image there, but I'm looking at the right foot. So when I'm looking at the right foot, let's go through those areas how we can stimulate the reflex points on the foot. So the first one would be around the big toe. That would be the neck area right here. So in reflexology, we use a word inchworming or a little movements of the fingers where I'm not disconnecting from the skin. I'm just kind of inching forward. And as you see, I am not pressing too hard. It's not about feeling the bones in the leg or in the foot. It's about causing an input on the reflex points, which will give the nerve ending the message to balance that area in the actual body. So I would definitely work around the neck area. The cervical is right here. So that would be also the idea of the neck is reflexology. We say that the body, this is the whole body. So if I look at this being the spine, this would be my right side of my body, and this would be the left side. The right side, I would have the liver. The left side, I would have the spleen. So the same, this is my right side, then this would be the right foot would be reflecting everything which is in my right side in my body. So obviously, I would work on both sides of the neck reflex area, and also here between the big toe on the side, that would be the cervical lymph nodes. But also, I'm going to go and press into the areas between the toes. So if there's a big toe right in between, and so the easiest way to do it if you're sitting comfortably and you're pulling up your foot, to do it with the opposite fingers. And also, if it's too hard, then you can ask maybe someone to stimulate those points for you. So these were the cervical. Now the spine reflection is all the way the medial side, the inside part of the foot. Now, if you think about what the spine here, So that would be the cervical, the thoracic, lumbar, and sacral. So the cisterna chyli would be somewhere in the middle. So when I'm looking at the foot, and that's my foot, I would use a glide pressure. So I would put my finger there and I would slide up, or you can do the inchworm with your forefinger or with the thumb, right? So from the cisterna chyli all the way up, across the top of the big toe, and I would bring it here in the between the big toe and the second toe, where it's going to drain. So that's the drain plug. So we are on the dorsal, on the plantar. We are working on the neck. We are working in between the toes, right? We are working cisterna chyli, fluid coming up and being drained into the thoracic duct area, which is right here between the first and second toe. On the bottom of the foot, the diaphragm would be right here, right under the ball of the foot. So how I would work that is I would grip both sides of my foot, and I'm not digging in with my fingernails. I'm kind of cradling, and I'm going to open and close, kind of moving the top of the foot to open up the lymphatic vessel, the area for the lymphatic vessels, which are, I'm going to talk about it later, but this is a very good way of getting the diaphragm and also the whole upper chest lung area opened up. So that's another movement what we can do at home, just kind of work with the whole foot. Now, the top part of the foot looks like this, and we have lymphatic little channels in between each toe, which starts at the webbing and goes up, just straight up from the webbing to the top of the foot, like this. So what I would do is that pinch the webbing and then walk up. Pinch and walk up. Pinch and walk up all the way to the pinky foot. Now, also, if this is too difficult, actually, I brought my wooden spoon. If you cannot reach that area, you can use a very nice, not sharp part of a tool, and you can gently scrape or press into that area for yourself as you are leaning forward, just like that. And then you can also pinch if you're able. The next idea is if this is the spine, then this is going to be my shoulder. My shoulder underneath would be under the armpit, which is the axillary nodes. So this would be an area where we can massage it gently, just kind of a circular massage for the axillary nodes to be stimulated. So this would be right here below the little bony structure there, and then you would massage or circle on both sides. Now, the lower lymph is going to be this way, this part of the foot. So, easy to find if you dorsiflex your foot like that, there's going to be a crease, right? So this crease here is the lower lymph reflex area. So how we can stimulate that is simply walking our fingers across one way and the other way under. This is my ankle bone. So I start underneath and inch walk around both directions. Also, just by bending the foot is going to pump that lower lymph area. And at the end, I would effleurage the kidney, which is right here, down towards the bladder. So let's just put this together. So I'm going to start bottom of the foot, neck area. I'm going to walk up from the cisternochyli on the spinal reflection and bring it up to the terminus or the thoracic duct. Then I will go open up the channels by flexing the metatarsal bones and the whole top part of the foot. Then I will inchworm across the diaphragm like that, going to the top between the toes. I'm going to pinch the webbing and walk up between each toe. Then I get to the pinky toe. I'm gently circling around for the axillary nodes. And if you want, you can also bring the fluid up here, which is the lower lymph. So again, walking one way, other way, and then from the lower limb, I'm going to bring it to the spine, cisternochyli, up, around, and into the thoracic duct. So that would be the foot. The hands would be similar. So this is my right hand. So that would be, let's find those areas. So in between the webbings, when I pinch the webbings, these are the upper lymphatic reflex points. Right, so I can just pinch into that. Then if I go a little bit inward between this line, the first and the pointer finger and the third finger, in between right here, that would be, I show both sides, where gently, I'm not pinching, just gently massaging both sides. That would be the thoracic duct. Then the diaphragm would be this way. So the easiest way is if you just kind of massage this middle part on both. Of course, we do both hands, just like that. And then when I'm flipping my hands, I'm going to walk these channels, starting from the webbing in between the fingers. The easiest way is just to pull it down with the other hand, like that. The cisternochyli would be right here, so I can walk up on the reflection of the spine, and the lower lymph would be this part, the outside. So not the inside of the hand, but the outside part. So again, I'm just walking, starting from the pinky finger side, walking the lower lymph, like that. And Of course, I would do the same with as I did with the foot. I would finish up with some of the other glands and other points, like for example, on the hand, the kidney would be a little bit more towards the center, and then I would bring it down just to flush everything. And if you're working with the let's say the pituitary, that would be in your thumb. So I'm just going to press into and circle into both thumbs. So again, the hand is a reflection of the body as we put it together. So the same right hand side of the body and left hand side of the body. All right, so I am done with my presentation. And if anybody has a question, then we have a couple more minutes I could answer them.
Thank you so much, Katie. That was such a useful presentation. It definitely explains why foot and hand massages feel so good. But also, I think that you sharing the research behind the method was really helpful because a lot of people, and I'm sure you get this, do see like those old Egyptian images of reflexology, and then they kind of see it as a pseudoscience, and they don't recognize that there is actually research behind it. And
Yes.
we at the association definitely have seen a lot of that research in the recent years. So that's why we were so excited to have you here because we know how useful it can be. So I'm glad that you provided some research and sources that people can look into because I know we have some therapists on the call as well, so they'll definitely be able to benefit from that and help their patients benefit from that.
Yes, and if anybody is interested, Sally's training, RLD, is for reflexology therapists. So you have your foundational reflexology knowledge when you go into the training. And what works really well, I myself also did the training online. So Sally offers 3 full day online training, and then you have to provide the case studies and send it to her. So that's again a better way. Let's say if you're not able to travel to the UK, then this would be very beneficial as a further development in our knowledge. Also, talking about research, I would also mention probably reflexologists have heard that Dr. Kuntz, who is a reflexologist, he wrote many books about reflexology. And in recent years, the last couple of years, they have done or started a study where in the States where they are performing reflexology sessions. And while a person is under an MRI, functional MRI machine. So in the MRI is going to show which part of the brain lights up. And then they, of course, in a study, they compare where they were performing a reflexology treatment. So this study is ongoing. They are still doing it as we speak. And Dr. Kuntz also gives us updates. And I think in the upcoming reflexology conferences, he will speak about this ongoing research. So if you're into research, that's a very good way of connecting how science can actually see the benefits or scientifically proven the benefits of reflexology.
Amazing. Yeah. And do you know of any other CLTs in Alberta who are in the know about RLD?
Sorry, what was the first part of the question?
Do
Do
you
I
know
know?
of other therapists, like certified lymphedema therapists, who are
Yes.
also aware of
If
RLD?
you are looking for lymphedema RLD trained reflexology therapists, you go on to Sally's website, the
Hmm.
RLD website, as I showed it in the presentation, and there she has a list of therapists according to each country.
Oh,
So you can find the contact info of each therapist, including some of us here in Calgary area and Edmonton area who actually trained with Sally.
excellent. Okay. Yeah, we can cross-reference that with our CLT list and maybe see who's trained in both, and then that could help people find someone who could be suited for them.
Yes.
And I know we had a question in the chat from Diane about the amount of pressure, the pattern for massaging spots, and you showed a lot of that in your demonstration. So like glide pressure for certain things, cradling, the use of props like a wooden spoon, circular motion on some spots, like walking your fingers. But do you have any general comments on that to share when people are
The
trying to do it?
general idea is gentle.
Gentle.
Gentle. It means that if you see the color of your fingernails changing, that's way too much pressure.
Okay.
So, what I would say is that I am not moving the skin, I am moving my finger on the skin
Okay. That's a
like
good
this.
general rule. Like you're not pushing the skin.
No, so I'm not, and as a reflexologist or when I'm doing this for myself, I usually put my foot right in front of me on a chair or my hand. You can put your hand on your body. So when you are doing the movement, you are actually not flopping in the air and kind of counter pressure with your hand. It's more you can gently move on the limb. So
Okay.
it's most important is even when I'm circling, it's very, very gentle. So if I would do this, let's say between my two fingers, I'm just circling. You can see that I'm not moving not pressing together.
Okay. Yes, that is a good tip. And I think that's the principle behind manual lymphatic drainage as well, right? It's not like a rough massage like people are accustomed to when they're trying to get like massages for their muscles. So the MLD is very different. It's very gentle.
Reflexology is very gentle. RLD is very gentle. So
Hmm.
if you think about it, what we want to do, we want to have the body answering to our pressure. If I am pressing too hard and causing pain, that pain is going to, in my system, in my nervous system, going to put me into the sympathetic nervous system response, which is the stress response. When I'm under stress, my body is not going to heal. It's going to say, "Oh, that's hurting. I'm I don't like that." So when I am working in general reflexology or RLD, the most important that I am putting the system, the nervous system in a parasympathetic nervous system response, relax, and then the body can respond with its balancing homeostasis in the certain part of the body. So it's very, very important that we are wanting the body, put the body into a relaxed state. And pressing too hard is not going to do that.
That's fair. Yeah. I think a lot of us live in fight or flight. So it's very good to do things that get us into that calming state. So breathing and getting us into the relaxed state so that we can tell our bodies or tell our person that
And it's
sympathetic
very,
nervous system that we're okay.
mhm. And it's very interesting that many times, let's say someone comes from reflexology not knowing much about it, and I'm doing my sequence and then say, "Oh, I don't feel anything." Well, because it's not a massage, right?
Mhm.
I'm not going down into the muscle level. I am just working the reflex points. So that's another other kind of important point that reflexology is not doing the same as massage.
Yeah, and I see Prakash actually commented in the chat, who is a therapist, I believe, was saying that they were thinking that reflexology was more uh, pressing hard, performed by pressing hard. So it's good to see that. Yeah, definitely. Good
Yes.
to know this. Okay, I'm not seeing any more questions coming in, but it was a very useful presentation. I know that you're a health guru in general, like you make your own chocolates and you have a lot of health products and things like that. Do you have any last recommendations for our audience?
I would say that, let's say this presentation hit a note with you and you really would like to do something for yourself, but it's hard to remember the points or whatever we did. What you can do is just gently massage, not massage, just touch the both sides of the hands and the feet, and that gentle touch is going to cover a lot of reflexology points and is going to have a calming effect. So that's one of the areas what I could say that just touching is very, very important for the health of our body.
Yeah, things you can just do at any point during the day while you're out and about, for
Yeah,
sure.
you can just simply, waiting at the red light and then just
Yeah.
massaging
Getting
the
mad at
very,
the traffic instead of doing
yeah,
that,
you just
you
kind
can
of take a
massage
deep breath
your
and massage the webbing of your
totally.
hands.
Okay, excellent. Well, we will post a recording of this on our website and YouTube, and then if anyone has additional questions, they can forward them to us, and we'll definitely reach out to Katie to get her insight if you need any additional insight. But other than that, thank you so much, Katie. This was a great presentation.
Thank you very much for having me, and hopefully it will help.
Good night, everyone.
Bye.